Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Dr. Jennifer Smith Ramey, the Director of Grants and Programs with Horizon Behavioral Health. Dr. Smith Ramey has been a licensed professional counselor since 1999 and has worked with a variety of populations, including adults with severe and persistent mental illness and adolescents with co-occurring mental health and substance abuse disorders. She is a professor of counseling at the University of the Cumberlands, where she teaches and mentors master's and doctoral students. Jennifer is also a consultant trainer for Chestnut Health Systems, serving as a lead trainer and coach for Chestnut's evidence-based practice center. And she has worked with Chestnut on various projects, including adolescent mentoring, services for the unhoused, family treatment, court, and others. Jennifer, welcome.
Thank you. It's a pleasure to be here. Thank you for having me.
Same. Just so everybody knows, I am doing this at my HQ in South Florida, where it is a chilly 40-something degrees. This is historic weather down here. Actually, this is the coldest it's been in 36 years, just so you know, Jennifer.
Yes. Well, for us, I'm in Central Virginia. I'm in Lynchburg. We're about 4 hours south of D.C., and 40-some degrees would be a heat wave for us right now because we have been digging out of snow and ice like we haven't seen in quite some time. So I think we're in maybe similar conditions based on our typical climate.
Yeah, I will say this. This past weekend had friends in from Cleveland, and they said the very same thing. Oh, 30s, 40s, piece of cake. Yeah, that's tropical climate for us, tropical weather for us. So they come down here this past Saturday, Sunday, when it's this cold, and they were bundled up. They weren't exactly parading around in T-shirts and shorts. So, cold is cold. I don't care what you're used to.
True story.
Anyway, so thank you for braving the elements and joining me today. I do appreciate it, Jennifer. So, as I mentioned in the intro, you've been a licensed professional counselor since 1999. So I have two questions. What drew you to this work to begin with? And what are one of the two most significant changes in your line of work over these past 27 years?
Sure, those are great questions. What drew me to this work really was a very personal experience. And I think that's not unlike a lot of folks that go into the helping professions. Oftentimes we go into those professions because maybe we've experienced some challenges along the way, or we've had family members experience challenges with mental health or substance use disorders along the way. So that helped shape my path. Just experiencing family members that have, had different struggles. And we know that recovery is a lifelong process and involves a lot of support, and not only from family, but from community. I'm sure we can dive into that later when we talk about some of the evidence-based treatments. So that largely directed me toward the helping professions. And then I also really have a servant leader mindset that I want to make a difference in the community where I live and work. And counseling offers me the opportunity to be able to do that, to work collaboratively, to work in partnership with community members. And going into counseling and working in public behavioral health specifically really allowed me those opportunities to be able to fulfill, my passions and needs that I had.
Yeah. Well, the second part of that question, when you think back 1999 to today, it's amazing how much has changed on various levels in business, in our culture over that period of time. So as it relates to what you do, what are one of the two most significant changes?
Absolutely. I did start in the mid 1990s. I came out of my master's program and went right into public behavioral health. At that time, everything, all documentation was paper charts. So one of the first transitions was, going to electronic health record and actually having computers. At that time, having a laptop in your office was unheard of. We had like one laptop in a collective area. So just from a technology standpoint, things have changed. And of course, they continue to evolve with AI. And I know we might talk about that in a few minutes too, but the technology piece has really changed since the 1990s. The other major change that I see, and this is really through my clinical lens, is treatment is more integrated now than it was decades ago. And I've told this story to my students. I'm teaching an addictions class now. And the very first class I talked about in the 90s and even before, treatment was very segregated in terms of substance use treatment and mental health treatment. The agency at the time that I worked in, which was a semi-rural agency in North Carolina, had two separate waiting rooms, a waiting room for folks that were receiving mental health services and a waiting room for folks that were receiving substance use services. And the mental health waiting room was in a bright, airy, nice part of the building. The substance use waiting room was like almost in like a cellar in the back of the building, like very hidden. I mean, for the first probably 6 months, I didn't even know it existed. And I was like asked one day, well, what goes on back there? And staff told me, oh, that's the drunk tank. So very, not only segregated, but high levels of stigma associated with substance use treatment. And it was thought at that time that you either got treatment for a substance use disorder or mental health. The providers were separate. They weren't, trained to do co-occurring disorders. So just a very different approach to treatment. And I'm glad that we have evolved since that.
Off of that point, what has evolved in your approach or how you view your work?
Well, being trained as a counselor, our identity as counselors and counselor educators is very strength-based and client-centered. So one of the approaches that I take, not only when I was practicing, but as a clinical supervisor and now as a professor training future counselors, is that we do want to make sure that we approach clients in a way that's relationship building. We don't need to approach them in a way that, hey, either you get treatment or I'm going to call your PO or, very judgmentally or, in a punitive way. We want to focus on their strengths. We want to build those relationships. And we believe in self-determination too, meaning that we recognize we can't make anybody do anything. We can show them options. We can guide them towards some possible solutions. But we want to ensure that we're using evidence-based relationship building models and tools to work with our clients.
Yeah. Okay. Excellent. You've also sort of partly answered this next question, but I think there's more to speak to on this. So tell us about Horizon Behavioral Health. The company is headquartered in Lynchburg, Virginia, and was founded over 50 years ago. What else can you tell us about Horizon? I mean, you laid out some general principles, which I'm assuming applies, and how Horizon goes about its work. But, how would you respond to that?
Yeah, absolutely. So we are a community service board, or CSB for short. In Virginia, CSBs are the publicly funded and single point of entry for all behavioral health, mental health, substance use, and intellectual disability services. So there are 40 CSBs in Virginia. We're located in Central Virginia. We cover multiple localities. So we cover the city of Lynchburg and then the surrounding counties of Amherst, Bedford, Appomattox, and Campbell County. And we are required by Code of Virginia to provide emergency services and case management. And we provide many more services than required. We have outpatient services that are office-based and telehealth. We have intensive outpatient services that include our substance use continuum of care. On the prevention end, we have a really robust prevention program that does programming and campaigns in the communities and in the schools. We have services up to residential treatment programs. We have a women's recovery home for women in early recovery from a substance use disorder. We have community-based programs for adolescents and adults. So, for example, we have an evidence-based program called multi-systemic therapy that works with adolescents 12 to 18 that have externalizing behaviors. We have a team that works with the family in client homes to help those families. And then we have a community-based team called an ACT team, Assertive Community Treatment, another evidence-based program that works with adults with serious mental illness out in the community. And we have other programs, but that gives you just a
Sure.
snapshot of what we do. We've really been focusing on crisis response and trying to work, I mentioned collaborating with law enforcement, with our hospitals, and working to divert clients in a crisis to treatment and out of the legal system, if at all possible. And
Right.
we can avoid higher level of care, hospitalizations, and keep people in the community with treatment supports. So that's been a big focus of Horizon. I'd say over the past 5 years is really trying to amplify our crisis response programming in the community.
One of the interesting things about doing these podcasts for the length of time I've been doing them is, I speak to people like you, I speak to Chestnut, Lighthouse people. I think generally those who are unfamiliar with this work or just know it at a superficial level don't understand the level of coordination it takes with all these stakeholders to get these things off the ground, to get it out into the community and do the work that you do. It's quite an undertaking. And by the way, you mentioned Appomattox within your sphere of influence. On my bucket list is to do a tour of a Civil War battleground. So when I do that, I'm going to have to swing by, just so you know.
It is a must do. Yes.
Yes.
Appomattox is a must see.
Yes, must do that. So you are director of grants and programs with Horizon. It must be a particular challenge these days. Yes?
Yes, I think that you nailed it. It has been challenging. I'd say the past year has been a challenge for us as grant writing professionals. Things have changed at the federal landscape, and then those changes have also trickled down to state and local changes in grants. Fortunately, working in public behavioral health, one of our important qualities and traits is that we have to be flexible and nimble. If we are rigid and stuck and have difficulties shifting, then yes, we're going to be very frustrated and feel very discontent. So when things started changing with regard to executive orders and different terminologies that we can and can't use. We tried to educate ourselves. We certainly, believe in aligning with executive orders. We also believe in providing evidence-based care to clients and community members. And so we've moved forward being able to do both things. And since these changes, we have secured federal grants. Actually, you mentioned Appomattox. Our last federal grant that we were awarded was a grant to expand the capacity of substance use treatment in Appomattox. So we launched that recently. So we have been able, just by staying abreast of the current landscape and current terminologies, we have been able to move forward with grant writing. It's been maybe more competitive. We've seen more organizations like shifting to try to get foundation grants, which makes that pot more challenging. But we feel like it may be opening up again. We're seeing a lot of forecasted notice of funding opportunities at the federal level. So we're excited about those opportunities and
Yeah.
really looking forward to trying to find projects that can map on to our community needs.
Yeah, no, that's very impressive. Again, another thing that has come out of these podcasts is the need to really be creative and improvisatory when you're out there in the field. There are just so many contingencies and unexpected things that happen, and you've got to deal with them fluidly in real time. But interestingly, that doesn't always translate to the way they do business. but clearly at Horizon it does. So that's particularly impressive. So you maintain that agility and nimbleness in the way you do your business.
We're very fortunate that we have an excellent executive team, an excellent finance team. So recently, and this was in the news with, when there were some very abrupt federal closures of grants that did affect us, we immediately, kind of circled the wagons and said, okay, what can we do? We want to make sure that services don't go disrupted with our clients. So we needed to plan for that. And we needed to also plan for staff that were affected by these changes. So we, had a plan within 24 hours of those notifications. Fortunately, they were rescinded the next day, but that is an example of the team here at Horizon just rising to that challenge and saying, we're going to work through this and forge a path forward.
Right. And as director of grants and programs, you are very much a part of that team. So kudos to
Thank
you,
you.
Jennifer. I mentioned in the intro that you work with Chestnut in various capacities over the years. When did you start working with Chestnut?
It's been a while. I think I've celebrated my 21st year, or this will be my 21st year with them. So I started in 2005, and I started because my agency, Horizon, received a federal grant to implement an evidence-based model called Adolescent Community Reinforcement Approach, or ACRA for short. And the proprietor of that treatment model is Chestnut. So that was my first exposure to that. We received that grant and we had them come to Lynchburg to do the clinical training. We love the model. We embrace the model. The model is very positive, client-centered. So some of the things I shared earlier. And our agency did very well implementing the model. We ended up getting a publication in a peer-reviewed journal with some outcomes. And consequently, Chestnut reached out and said, hey, we're expanding our training team. We're getting more projects, more need to train folks in this model. Would you be interested in being a trainer? And I said, absolutely. I'm excited to do that and share my passion for the model. So I started out as a junior trainer under one of the model developers, Dr. Bob Myers. And that was just an incredible experience. If you haven't had Bob on your podcast, I would highly recommend it. He's just an incredible researcher, practitioner, human being. So I trained under him for a while. And then when they felt like I was ready to do lead training, I traveled to different areas in the United States and abroad. They sent me to Australia to do a training there as well. So I've been training for them ever since. Before COVID, we would go on site and train across the country. And then with COVID, we've shifted and we do virtual trainings now because that's easier for folks and less costly.
Is this all done within Chestnut's evidence-based practice center?
It is. So the Evidence-Based Practice Center manages all the training contracts. They set the training schedule. So every other month, they conduct a virtual ACRA and CRA, the adult model training. And I'm one of many on the training team. So they have other lead trainers as well. But we all love doing the training. It's always fun when we can come together and do the trainings.
Has that changed over the last handful of years, the way you do training? Obviously, there are some tools where you can do more of it in a more robust way virtually. Is there
Yeah.
anything else that's evolved in your training?
Yeah, so certainly that shift was a big shift for us, moving the training virtually. I'd say another emerging shift is using AI in the training space. They've been piloting AI clients to use to help train clinicians, which is a wonderful experiential way to use AI. And I'm not sure if that's launched yet. I was part of the pilot process and the testing. But that's been exciting too, because any tools that we can give that are hands-on experiential tools to to clinicians and trainees is very useful for them as they prepare to implement the model.
Yeah, for sure. In our discussion leading up to this, we discussed your experiences collaborating with researchers and trainees from around the world. From a learning and training perspective, what generally do you have to account for or accommodate when working with students from other countries and cultures? With, of course, the caveat or proviso that different cultures, there are different subtleties, different orientations, and you have to be mindful of those differences. But is there any overarching approach that you take?
Yeah, I think seeking to understand, I mean, it can't be underscored enough the importance of, understanding or seeking to understand people that might have a different culture, live in a different part of even the United States. I mean, I certainly have students and trainees from around the world, but even the United States, very different cultures. I mean, I'm here in Central Virginia. I have students and Washington State and Florida, New York, Kentucky, Tennessee, Texas. Um, so seeking to understand, where they live, their geography, their experience, and feeling comfortable in the classroom setting, um, having those discussions because you may have students that have differing viewpoints on perspectives and topics within the counseling space. And I feel like my role is to facilitate those exchange of ideas, but to make sure that that's done in a respectful way, in a way that everybody feels heard and feels safe. So that's part of my role, in managing, students and trainees that may have different experiences or be from different parts of the world. Um,
I'm curious on the client side or even the grant writing side, is there more demand to show and to use technology in your work? Is there even a greater expectation of that? And do you need to be sort of very mindful of that in how you do your outreach? I mean, your business outreach?
in terms of using technology, um,
Well, in terms of is there increasing demand, or do clients or prospective clients ask you more and more about the technology you use? Is that a barrier, or is that a box that is increasingly needing to be checked when people are vetting you for your services?
I would say the younger population feels more comfortable using technologies, smartphones, telehealth, than maybe folks like my age. And I don't mean to overgeneralize or like stereotype, but I mean, we do see that. For example, historically, when we would follow up with clients, maybe to do a reminder calls, or maybe they missed an appointment and we want to follow up. I mean, that was always telephone. We get on look up their phone number and call them on the phone. But these days, especially with kids and young adults, they're generally speaking don't want to answer a phone. It's
Right.
but we can text them.
Right.
They may communicate with text. So I think we do have to adapt our outreach and communication methods for the population. We have to tailor that because I don't think there's a one size that fits all.
Yeah. And again, that seems to be your overarching approach when you're dealing with trainees from abroad, et cetera. Just the idea, and in your business practices, just agility, nimbleness, and all things.
Yes, absolutely, absolutely. Yeah, some folks, and the nice thing about technology in terms of the population that we serve is I do think it's increased access to care for some people that otherwise may not be able to access care. For example, we have a lot of rural localities in our area, and transportation, and we see this on every community health needs assessment. Transportation's always a huge barrier to care. But now with telehealth opportunities, assuming the communities have broadband, sometimes that's an access issue. But we've been able to outreach, and more folks have been able to receive behavioral health services, psychiatric services than ever before.
So, last question. What big plans do you and Horizon have in store for the year ahead, to the extent that we can plan in this environment?
True. Very true. Well, I mentioned we've been eyeing all the forecasted grants that hopefully will be released over the next several months. I mentioned earlier crisis services. Horizon has been building a crisis receiving center, so a physical building here in Lynchburg that we hope to open in the next few months. So that's probably our biggest project or accomplishment that we have on the horizon, no pun intended. And this will be a facility that will do detoxification services, crisis intervention. We'll have 23-hour beds for clients. We'll also have residential beds for them. We'll be able to do emergency custody order evaluations for clients that are in a behavioral health crisis there on site. So we're very, very excited about this facility that will be opening, and it will be regional. So we not only want to serve our community, but the greater area as well.
I'm hearing over the course of this conversation that there is an increasing need for crisis intervention. Am I hearing correctly? And if so, why is that?
I know. I think that you are hearing correctly. You've certainly picked up on that. I think there are a number of different reasons. I mean, lots of variables. As a researcher, we're always looking for variables and hypotheses, right? So I think COVID was one precipitating factor, particularly when I look at the data for adolescents and the increased rates of depression, suicidal ideation, anxiety. I mean, that skyrocketed during the COVID time, and I don't think we fully recovered from that. So I think that's one reason. I think another reason, another factor is the substance use crisis. I know historically that's been called the opioid crisis, and now we have, opioid abatement funds that are flowing into the community. We're happy to have those to be able to develop some programs and services. I think it's beyond opioids. I know in our area, it's stimulants, methamphetamine as well. So I think the substance use crisis also exacerbated that. I think honestly, the socio-political climate can be challenging for folks too. When you're getting news 24/7, that can be challenging for people to really try to integrate that, and that can cause people to feel anxious, on edge, uncertain. So I think a number of variables, quite frankly. And then awareness too. I think we also, as we evolve as a profession, we're seeing, that there's more of an awareness that we need to have these crisis intervention services so that we can keep people, if we can, out of jails, out of hospitals, out of residential treatment facilities, if we can. I mean, we need to always, assess and triage to appropriate levels of care.
That's great. Well stated. I was really interested because I seem to have heard this theme emerging in our conversation. I was wondering if I was hearing correctly, and if so, what exactly is driving that. So that's really interesting. And by the way, the outset of this conversation, I applauded the both of us for soldiering through this rough patch of weather. And if I may say this, I want to give you kudos and thank you because you are dealing with a touch. I don't know if you can say a touch of COVID. It's either COVID or not. You can't be half pregnant, right? But you do have COVID, and I guess it's a matter of how severe the symptoms are. So thank you for soldiering through that and doing this, Jennifer. I really do appreciate it.
Oh, it's my pleasure. I really enjoyed talking with you. So thank you for having me.
Yes. We'll have to revisit some of this stuff a little bit down the road this year. Today, I spoke with Dr. Jennifer Smith Ramey, the Director of Grants and Programs with Horizon Behavioral Health. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.